In our previous video, we showed how to use the model roller in the lumbar spine. I wanted to cover using it in your upper back and possibly into your cervical spine. I usually have people start in the low back because it's easy to get into position in the lumbar spine. Usually what I have people do is start in the low back. We talked about having your knees bent, having your arms down by your side. Slowly what will happen is as I release the musculature in my low back, I'm going to slowly scoop myself inchworm style down and allow the model roller to come up my spine. So as I allow my body to move down and allow the model roller to work its way up my spine, I'm working into a different area. The upper back tends to curve out, which means that there's a little more pressure with the model roller. You just take it slow and easy. And again, you continue walking it up the spine. You can continue walking along. You'll see that I get a little bit of a back bend here because the model roller is pushing up into my spine. It may feel more comfortable to have your arms up above you. And I'm going to move it even a little bit higher. Now, I have more practice at this, so I can literally lift myself up and just roll up and down. For most people, they would find that painful or uncomfortable. The musculature along their spine is too tight, too tense to allow that. But you'll see it's right underneath and in between my shoulder blades at the moment. Just like before, you take a big in-breath. And exhale through the nose. Allowing the body to sink onto the roller so that the knobs can massage the musculature along either side of the spine. And then once that area has let go, I can always scoop down a little bit more. You can do this all the way up the spine, eventually even up into the neck. So I'm at the very base of the neck, very top of the upper back, and then slowly I can use my hands, I can work the roller all the way to the base of my head, the top of my neck at the occiput. I'm going to use my thumbs to hold it in place. But I can lay down here, I can always tuck my chin and look down towards my knees. I can look up. But as you're working on the roll, where's the sweet spot? What do you feel? What I want you to feel is something that's intense, but not painful. If it's painful, try the same spot, but try to use less pressure. Maybe change the angle. And when you were ready to come up, you can always lift the head, pull the tool out. You can lay back. Again, you can use the roller all the way from your low back into your neck. Just go slow, go steady. I highly recommend, if you have back pain, try doing this and build up to about 30 minutes. Breathing very deeply through your nose. Be very focused, very conscientious, listening to your back. Now when I say listening, I'm not talking about your ear, I'm talking about your nervous system. What do you feel? You'll get to a point where if you've had low back pain, you'll eventually press in the lumbar paraspinal musculature, in those muscles that the roller presses into, to the point that it no longer feels intense. It feels like it's gone away. Then that's when you have the roller work its way up the spine. I recommend, again, you start in the lower back, then work your way up. The upper back is a little bit more tight because of the curve of your spine, the normal natural curve. Take it slow, go at your own pace, and breathe. I'll see you again soon on robertgardnerwellness.com.